So one of the things I think that kind of came across today was kind of patchy access and experience of mental health provision. CQC figures showed that less than half of those who actually managed to access the mental health provision said that they got what they needed. I think it was 39%. Why is that?
Various reasons. I think increased demand over the last sort of 5-6 years, and then workforce not keeping up with that demand. There's significant workforce shortages. I think there has been a lot of investment and a lot of focus on the mental health workforce, and we have seen improvements, but nowhere near enough compared to demand that we're seeing.
Can I just very quickly ask you, just for the report, is that because we're not training enough people? Is that because not enough people are going into training, or is that because we're not employing enough people?
I think there's a kind of, because of the long amount of time it can take to train, obviously psychiatrists, but then also mental health nurses and so on, there is a lag time. So I think there has been investment since the long-term plan and the workforce plan, but there is a lag to then us being able to see that workforce actually coming in and providing support. And in the meantime, we've seen a lot of retirements as well, and a lot of people moving out of the workforce. I think there is a vicious cycle problem as well with mental health, where the more we see people go into working in mental health in order to do good and care for people, the more we hear about how that isn't happening in mental health, and that you're in a lot of cases when we talk to professionals, they say I'm basically here just as a gatekeeper, not to actually care for people. There is a real problem with culture and people wanting to do a good job and not to go in just to be a gatekeeper. It's really about looking at the voluntary sector and other forms of workforce like peer workforce to be able to be there to support people. And again, as we heard earlier, a lot of what people have found the most beneficial to their recovery has been peer support, navigation, and the voluntary sector stepping in and providing that real local community and kind of creative art form of therapy and so on.
And then just kind of moving on to that, I think maybe more for Courtney and Harry, but are we kind of a little bit too focused on expecting people to be the perfect patients, no co-occurring conditions, and things like that, and what kind of models help us move beyond that?
Yeah, I would emphasise the point that in dealing with increased demand in mental health services, we are seeing trends in lots. It takes some thinking to join them up of how to, in essence, turn people away from mental health services. That there's kind of a nudge in that direction as well. So I think, if you look at changes in welfare reform, in, as I said, these innovations that are happening in mental health services to deal with high-intensity users, frequent flyers, the suspicion becomes, somewhat that the perfect patient is just not a patient. And to build on a point as well that we've heard, often that, excellence, or at least in the previous panel, that the excellence of the third sector, particularly, this peer workforce that you're talking about, et cetera, and I think that work is essential, and, I'm biased, perhaps, in that regard. To emphasise that sector is one also in financial crisis. That is one that is also chronically underfunded. Over 90% of those organisations are experiencing increased demand. Over 40% also don't think they're going to financially survive. For the most part, what we see is like large-scale charities getting huge amounts of funding and money, and then these smaller organisations, the praises of which have been sung today, are facing huge barriers when it comes to accessing funding, being sustainable themselves. If that is a workforce, we are putting the emotional labour of picking up the slack of a mental health crisis in failure on people to do the emotional labour that system is not doing. So that workforce is also, requiring support and care, but is having additional burdens put on them.
Yeah, I think with your question, I'm thinking about it from two angles. I suppose one is the sort of service user perspective on these things. Even if you get through to services and they might be adequate, if you've waited for over a year, that you probably don't feel like you've gotten what you required. And then there are a lot of the other issues which have been discussed through the first panel. I think on the sort of more institutional or systemic side of things we know about are the workforce shortages, funding pressures, and disruption around sort of team restructuring, and all of these have been compounded by the COVID-19 pandemic as well. I think it's challenging, it's really difficult to implement transformations when systems are strained and exhausted in all these other, being pulled in all these other directions, and staff get burned out as well, like especially the sort of moral defeat where you go into these sort of professions wanting to help people and it's not happening.